Okay, so the dental cycle. What is the dental cycle? I have to explain this to patients numerous times a day because it's a big problem in dentistry. So the dental cycle basically is, say, the life cycle of a tooth in most people. So let's draw a tooth. This is a molar. Got two roots, come down here like this. All right, so there's a tooth. Well, what happens is usually you get a little cavity right in this area of the tooth. Kind of those deep pits in the grooves in the molars. Most of the time there's a little cavity in there. So the way that this is treated traditionally is you drill a big hole in the middle of the tooth in kind of a dovetail shape so that those fillings will stay and they won't come out. They're kind of locked in there. But what this does is if you put a filling right in the middle of the tooth, it reduces the strength of that tooth. So now this tooth is weakened. It's weakened up to like half of what its original strength was. And teeth are really strong, so for a while this isn't a problem. And most of us, we get these fillings done when we're 8 years old, maybe teenager or something like that. And they last well for a decade, 15 years or so. But over time, as we're putting forces on these little bumps on the teeth and side-to-side forces, what that does is since that tooth is weak, it's going to want to kind of flex right here in the middle. And that creates cracks in the teeth. Over time, it starts to crack. And if you're looking at the top of the tooth, say we're looking at the tooth from the top. Here's your molar from the top, and it's got this filling in the middle there. Nice dark filling. Well, what happens over time when it cracks, you start to get a little crack here, a little crack here, maybe some this way, and then you have another tooth right here. So this crack right here, as that opens up, that allows fluid and bacteria to get down in there, and it'll form a cavity. Form a cavity under the filling or even away from the filling down between these teeth. And what do dentists tell you when you get a cavity between the teeth like that? They say, well, you're not flossing, are you? And the patient says, no, I'm not flossing. Of course not, nobody flosses. But a lot of times these cavities are not necessarily due only to lack of flossing. Okay, it's due to cracking of the teeth. And cracking of the teeth is a big problem. Once you know what to look for, I see this day in and day out on my patients. And most of the time it's blamed on poor oral hygiene, poor brushing habits and whatnot, when really it's just the poor tooth finally getting weak and starting to crack after a long time. So then what happens is this filling, say it gets a cavity under here from the crack, not from a dirty mouth, but from that crack. And so then what happens is the filling has to be even bigger. It's a really big filling. So now that is your new really big filling. Well, the tooth now is even weaker structurally. So that filling is going to last even less time than the original filling. And the next time it's going to need to have a crown or maybe a root canal or both. Or say this tooth cracks down the middle like that, down into the root, and that tooth is lost. And so then, you're down a tooth. So then we have to do, if you want to replace it, a dental implant or a bridge, partial denture, something like that. So this is the dental cycle. Small cavity turning into a regular sized filling, turning into a bigger filling, crown, root canal, tooth is lost. So what this costs is a lot of money, okay, and also a lot of time in the dental chair, a lot of hassle. Anyway, no fun. The best way to avoid or to solve this problem is to avoid it in the first place. In other words, prevention. Prevent that one small cavity from forming. And the goal in my practice for children that grow up in my practice is to never have a drill touch those teeth, to keep them cavities free and also filling free so that those teeth are in their natural state, untouched by a dental drill and strong. But for a lot of us, me included, that's too late. I've got the fillings already. I've had them for a while. And they're already starting to break down in my mouth and a lot of my patients too. The damage has already been done with the filling. So what do we do then? Well, the way you can fix that is by placing a restoration or a filling in the tooth that not only just plugs the hole up and looks white and looks pretty, but it also restores the strength of that tooth. So then the tooth's not flexing, no more cracks are forming, the cracks are repaired. We put that tooth back into its original state, as close as we can anyway, with the materials and stuff that we have. And we've named that filling that replaces the strength of the tooth as well as plugging up the hole. We've named that biomimetic, okay? And bio meaning like nature, and mimetic, that means, to mimic or to emulate. So these fillings try to mimic nature by, making the tooth strong as it was originally. So those are the two things we try to do in our practice: is eliminate the dental cycle by, 1, avoiding little fillings in the first place, and by 2, replacing the fillings with strong fillings that hopefully was the last filling you have to get the rest of your life.